Hello everyone, welcome to Mbbs Sub. In today's video, we are going to explain about the necrosis. Okay, coming to the necrosis. What is the definition? Necrosis is the localized area of death of tissues followed by the degradation of tissues. That means in that particular area, the death of the tissues will happen. That of death of the cells, and there will be degradation of the tissues by the hydrolytic enzymes, and then it undergoes to the inflammatory reaction. It should be important to remember that the inflammatory reaction will occur only in the necrosis. Okay, necrosis only the inflammatory reaction occurs, and it is caused by the various agents like hypoxia and chemical and physical agents and microbial agents and immunological injury. Okay, coming to the types of necrosis, there are 5 types of necrosis. And first one, coagulative necrosis. It is the most common necrosis and caused by the irreversible focal injury and sudden cessation of the blood flow. That means the blood will be stopped. The blood flow will be stopped. Okay, the artery will be blocked. This is a cessation, and the main organs affected in this are heart, kidney, and the spleen. Okay, in this early stage, it will be pale, firm, and slightly swollen. After it becomes yellowish in color and softer, and it will be shrunken. And if you see microscopically, the cell type can be recognized, but the cytoplasmic and nuclear details are lost. Okay, the cytoplasmic and nuclear details are lost, and it leaves granular debris and fragments of the cells. In this way, you will see there will be inflammatory cell infiltrate. Okay, it is there now. It is the remnants. Okay, these are the renal tissues. These are the necrotic tissue. Okay, it is the kidney, injured kidney. Okay, coming to the next, liquefactive necrosis. It is the commonly occurs due to ischemic injury. Okay, commonly occurs due to the ischemic injury and bacterial or fungal infections and bacterial or fungal infections. This is mainly occurred in the infract brain and abscess injuries, and there will be necrotic debris. Later, the cyst is formed, and in this capillaries proliferating, the capillaries will be there, and inflammatory cells and gliosis. Inflammatory cells will be also there. Here you can see gliosis. This is gliosis, and there is granulation tissue, and there is a liquefactive necrosis. This is liquefactive necrosis. And coming to the third necrosis, seizures necrosis. It is found in the center of the foci of tuberculous infections. Combine both coagulative and it is combination of the seizures necrosis is the combination of the both coagulative and liquefactive necrosis. Okay, it is a dry cheese-like appearance. Seizures means it is cheese-like appearance. Okay, it is cheese-like. Okay. And it is a soft granular and yellowish in color. And coming to the 1 minute, yeah, this is the seizures necrosis. Here we can see granulomatous inflammation granules, and there are it is the seizures necrosis. There are we can see there are lymphoid tissue, able in lymphoid tissue. Okay, granules are present in the seizures necrosis. And coming to the fourth one, fat necrosis. It is a special form of cell death occurring mainly at the fat-rich locations in the body. In females, the mostly fat is stored in the breast and in heavy and pendulous breasts. In this mesenteric fat necrosis due to these are the one example in heavy and pendulous breasts. Okay, in heavy and pendulous breasts, and another example is mesenteric fat necrosis due to the acute pancreatitis. It is in this acute pancreatitis there will be fat deposits throughout the peritoneal cavity. The fat is deposited in the peritoneal cavity, and sometimes it is affects the extra abdominal adipose tissue also. Okay, and these it is in the yellowish and white, and firm deposits will be there in the fat necrosis. Okay, here you can see in this cloudy appearance, this is all the cells, and this is the acute inflammatory cells. In this area the inflammation of the cells is secured. It is a histological diagram of the acute pancreatitis. Okay, coming to the fibrinoid necrosis, it is a deposition of the fibrin-like material which has the staining properties. Okay, it has the fibrin-like material which has the staining properties are present, like phosphotungstic acid hematoxylin. Example, autoimmune diseases and autoimmune vasculitis. Autoimmune diseases like Down syndrome, Klinefelter's, like those autoimmune diseases will be there, like that. And in this peptic ulcer and hypertension, etc. are occurred. And in the vessel wall, hyaline deposits will be there in this. Okay, this is the nuclear debris and viable PMNs. And it is the fibrinoid necrosis. Okay, it is the fibrinoid necrosis. This is today's video, guys. Thanks for watching.